Dr. Kumar Rao. I am a pediatric nephrologist currently working in Neotia Bhagirathi Hospital, Newtown. So today, in coming few minutes, we are going to discuss about high blood pressure in children. I know that whenever we speak to this topic, many of the parents have a frowning on their forehead. There are multiple questions roaming around. Does our children have high blood pressure? How can we detect this? How it is? Why it's so? What are the reasons? I know there are multiple questions roaming around, and mostly some of them are not clear that much. So in the next few minutes, we will try to explain how. So as a contrary, high blood pressure in children is not that rare. So as per our literature says, around 3 to 5% children out of every 100 will have high blood pressure in our community, and another 4% around will have a pre-hypertension that we are previously talking about. Now it's also called elevated high pressure. So with this burden of children, why some of our babies has a high pressure, why some don't have? There are some certain risk factors also for this. So how to know this that my child is having high blood pressure? Because as a normal rule, they are mostly silent killers. Mostly they don't have a gross symptoms to diagnose. So the only way is to measure your child's blood pressure and record it and document it. But unfortunately, even if I talk in an optimistic way also, hardly more than 80% of my children who visited my clinic regularly, under 5 children, hardly have any blood pressure recording previously. So we, with more consciousness around, so we can have our pediatricians request our pediatrician that we can have at least one blood pressure measurement annually for any children who is more than 3 years, whenever maybe they are going for a routine visit, or in some at-risk children like the children who are born prematurely, the children who have some kidney diseases, some heart diseases, some red urine ever in their past history, who have repeated urine infection, which of the child are on steroids or some are on antipsychotic drugs which are known to cause high blood pressure. This type of children should have a blood pressure document at every visit when they visit a hospital. Even if the children who are less than 3 years of age, they should, if they have this type of risk factor, they should have at least every normal visit or vaccination visit blood pressure measurement done. So what we can do, we can request our pediatrician to go for the same. I know it's easy to talk rather than to do, because measurement of blood pressure in children is too tough. We know, because it's not like adult. If you are visiting your pediatrician, any adult physician, this type of machine will be there, which are basically the adult machine. Here the machine actually doesn't matter much. What matters are the cuff size. So if your doctor are ready with this type of machine to measure your child blood pressure, don't be annoyed that this is the old-fashioned thing. This is the ideal gold standard for measuring blood pressure. This is the mercury manometer. The other machines which your doctors are usually using is these Ernan machines or these recently automated oscillometry machines. All machines can be, if well calibrated, can be used for your child. Why matters are those curves, like this adult cuffs which you have seen, or we have some of these machines at our own home. These are some pediatric cuffs for your child. These are some cuffs for your infant who are less than a year age. And these machines we usually use to document our blood pressure in our clinic. So if your physician sometimes miss in a busy schedule also, you can remind them to have the blood pressure checked at least yearly once for every child who is more than 3 years. That's the key message. And the timing is also equally important, because whenever your child is either running or playing around, or in the waiting lounge for a 1 hour or 2 hour waiting, they may be either playing or hopping around, and after it there is a high blood pressure measurement. So don't get panic on this. A single reading which is high, we are not considering it. We have to document it multiple times at least before labeling the child as a patient of high blood pressure. And the reverse is also true. A single normal pressure for those at-risk child also does not rule out hypertension at all. So we need multiple times of measurement. And even if your child is diagnosed to have a hypertension, whenever we plan to start a treatment with simple or behavioral therapy or like this, we need to document the blood pressure measurement in this type of machine. This is also called an ABPM machine. This is a mobile-like small device. We can attach the machine in your child's arm or waist, and this machine will automatically measure your child blood pressure throughout the day, 24 hours, automatically, maybe every 3 to 4 times an hour, and that will be recorded in an inside chip. And whenever we decode the chip, we can know the idea that your child is having a high blood pressure or not. So once your child is having such high blood pressure, then our findings are why your child is having high blood pressure. In contrary to adults, where more than 50% may have a primary hypertension, maybe their familial history of hypertension like this, they are obese, they are diabetic, and some other risk factor. For children less than 5 years of age, if there is a hypertension, we usually consider it as some secondary pathology, means some underlying other diseases going on, and mostly they are of either kidney disease, secondly being cardiac disease, and thirdly that can be some endocrine or maybe some adrenal gland disorders like this. So that's why, as in contrary to adult high blood pressure where it is mostly managed by cardiologists, adult cardiologists, for pediatric hypertension or high BP is mostly managed by pediatric nephrologists, though it varies from center to center. So the bottom line is, whenever your child is diagnosed with this high blood pressure multiple times, don't get panic. Just the solution is not simply a drug, it's basically a lifestyle change, a behavioral management. So the first thing which comes into mind is our diet modification, also called some DASH diet, where we give at least some restriction which is feasible of salt, of a good amount of fruit, a good amount of fiber diets, and obviously a daily routine exercise at least 1 or 2 hours per day on a routine basis. And after, when this behavior therapy has been addressed well, that time we start on different type of area of drugs. Oral medicines are available. We may start with a single drug, and if it is not controlled well, we can add on multiple drugs one by one. But a long-term follow-up is needed. Many times it's happened that when your child BP is obviously well on multiple measurements, or even if it is a home measurement, then many times parents do stop their medicine thinking that it's okay. But it's not advisable to stop any blood pressure medicine without consulting a doctor, even if your BP is normal on repeated events. So if your child is in fact diagnosed with this hypertension, don't get panic first that this is a rare thing which is very unusual in children, but at least address the problem well. Remind your pediatrician regularly that at least yearly once blood pressure checks should be advisable, and whenever your child or your boy is diagnosed with such type of hypertension, you need a long-term follow-up, and preferably one opinion from your pediatric nephrologist regarding to find out whatever is the cause, how to manage it well, and how to follow up it as per according to plan. Okay, if you have any doubts or problem regarding the same problem, you can always contact in our hospital 24/7. Thank you.